Okay, so the first thing that I'm going to palpate for is the patellar ligament. So the first thing I'm going to do is palpate for the patella. I know this is the superior portion of the patella and this is the inferior. I'm going to go slightly below the inferior portion of the patella, and I can feel the patellar ligament here. The next thing we're looking for is the vastus medialis. So the next thing I'm going to have my patient do is a quad set. So I'm going to have you push your knee back into the back of the table. I'm going to go superior from the patella, which is going to get me to the quadriceps tendons, and I'm going to go medially, and I can palpate the vastus medialis as it's a teardrop muscle on the side. All right, I'm going to have my patient bend both of his legs. And the next thing we're going to look for is the MCL, or palpate for. So the first thing I'm going to do is find the medial aspect of the patella. I'm going to go slightly inferior to find the groove, and then I'm going to go inferior down the medial groove line to where it drops off, and I can feel a thickening right here, which is where his MCL would be. All right, so the next thing we're going to palpate for is the lateral femoral epicondyle. So on the lateral side of the knee, I'm going to start with the median aspect of the patella, and I am going to drop down, and I can feel a bony prominence here, which is where we'll use the goniometer to measure range of motion. All right, so I'm going to have my patient bring both of his legs down, and the last thing we're looking for is the greater trochanter. So the first thing I'm going to do is palpate for the iliac crest, or the top of the hip bone. And once I find that, it's going to be about 1 hand's length down inferiorly, about middle of the thigh. And here I can feel the greater trochanter, which is where we would measure hip range of motion with a goniometer, and I feel a bony prominence here.